What are the side effects and risks of hair transplant, its causes and its treatment? Welcome back to our channel Saraswat Hospital, where we explore everything you need to know about hair and beauty, and where we share genuine and verified information about hair transplant, lasers and cosmetic surgery. I am Dr. Satya Saraswat, a gold medalist, plastic and cosmetic surgeon and American board certified hair transplant surgeon. In today's video, we will dive deep into the short-term and long-term side effects of hair transplant surgery, discussing their causes and potential treatments in detail. We want you to be well informed about every aspect of this procedure, so let's get started. Coming to the part 1, the common side effect. The most common side effects of hair transplant surgery include swelling, pain or discomfort, bleeding, redness, and scabbing or crusting. It's essential to remember that these side effects are usually temporary and mild. Let's take a closer look at each side effect, its causes, and how to manage it. Now, coming to the first side effect, that is swelling. Swelling occurs when fluid accumulates in the tissues around the forehead and eyes after the surgery. This is a natural response to the trauma or the injury, such as during the hair transplant procedure. Swelling typically peaks around the second or third day after the surgery and subsides within 2 to 5 days. The home treatment of swelling is to apply a cold compress to the swollen area. Use a clean cloth or ice pack wrapped in a towel. Do this for 15 to 20 minutes several times a day. Also, you can keep your head elevated when resting using pillows to support your neck and shoulder. Your doctor may prescribe anti-inflammatory medications to help reduce the swelling, which are generally kept in your post-operative kit. The second temporary side effect is pain or discomfort. Mild pain or discomfort is common after the hair transplant surgery, particularly at the donor and the recipient site. This is due to the incisions and the hair transplant process, which can cause temporary inflammation and sensitivity. The treatment of this problem is painkillers, which relieve and alleviate your pain and are given by your clinic in the post-op kit. Always follow your doctor's recommendation for dosage and frequency of these painkillers. You can avoid activities that may aggravate the pain, like bending over, heavy weightlifting, or vigorous exercises. Third side effect is bleeding. Minor bleeding may occur at the transplant sites due to the small incisions made during the procedure. It is common for some minor oozing to be present in the first 24 to 48 hours after the surgery. The treatment of this minor oozing is application of gentle pressure with a clean cloth or a saline soaked gauze, and this can help in stopping the minor bleeding. If the bleeding persists or worsens, contact your doctor for further guidance. Avoid activities that may increase the blood flow to the scalp, such as strenuous exercises or bending over. Now, coming to the fourth temporary side effect, that is redness. Redness at transplant sites is common and typically results from the body's inflammatory response to the surgical procedure. This is a normal part of the healing process and should fade within a few weeks. The treatment of this redness is keep the transplant area clean and follow your doctor's post-operative care instructions. Be patient, as this redness will gradually subside on its own. If the redness worsens or is accompanied by other symptoms such as pus or increased pain, this can be due to infection and you should contact your doctor. The fifth temporary side effect is scabbing and crusting. As the transplant sites heal, you may notice scabs or crusts forming. This is a natural part of the healing process as your body works to close the small incisions made during the procedure. Scabs and crusts will usually fall off within 10 to 14 days. The treatment of this is keeping the transplanted area clean and gently cleanse it with a mild shampoo and a lukewarm water as advised by your surgeon. Do not pick or scratch the scabs as this can lead to infection or damage of the grafts. If scabbing persists or worsens, contact your doctor or the clinic for further guidance. Now coming to the next temporary side effect, that is itching. Why does itching occur after the hair transplant surgery? Itching is a common side effect after hair transplant, often resulting from the healing process. As your skin recovers from the procedure, new cells form, which can create a sensation of itchiness. Additionally, the scabs and the dryness at the transplanted site can contribute to this uncomfortable sensation. Now, how to manage this itching? To manage itching after the hair transplant surgery, follow these helpful tips. Tip number 1 is that you should keep your transplant area clean. You should gently cleanse the area with a mild shampoo and lukewarm water as advised above. This will help in prevention of infection and will reduce the irritation in the transplanted area. You can also apply a soothing topical solution which your doctors may recommend, such as an aloe vera gel or a barrier repair cream, or a coconut oil application can also be done after a few days. This soothes the itching and moisturizes the scalp. Then avoid scratching. Scratching the itchy area can lead to infection or damaging the graft. If you feel irresistible feeling of itching, you can gently tap or pat the area to alleviate the itch. Then please stay hydrated. Drinking plenty of water helps your skin hydrated, which can minimize the itching. While mild itching is normal after the hair transplant surgery, there are instances when you should contact your doctor. If the itching is severe and persistent despite following the recommended care routine, or if you notice signs of infection such as increased redness, swelling or pus, or if you are concerned about your healing process and progress or the appearance of the transplant sites, you should contact the clinic and the doctor. Itching after hair transplant is a common side effect, but by following the proper care routine and using the soothing treatments, it can be managed effectively. Now coming to the part 2 of this video, where we will discuss the less common side effects of hair transplant. Some patients might experience less common side effects including infection, folliculitis, numbness and hiccups. So let's explore the causes and treatment for each of these side effects. Number 1 is infection. Infection can occur post-surgery if proper care and cleanliness is not maintained. Bacteria can enter the transplant sites, leading to the infection. This is treated by following your doctor's post-operative care instructions to keep the transplant area clean. Your doctors may prescribe the antibiotics to prevent or treat the infection. If you notice signs of infection such as increased redness, swelling, pus or foul odor, contact your doctor immediately. The other side effect is folliculitis. Folliculitis is the inflammation of hair follicles which can lead to red, itchy bumps resembling pimples. It may be caused by bacteria, fungus or irritation from the transplant procedure. The treatment of folliculitis is again to keep the transplant area clean and to avoid scratching the itchy areas. Your doctor may recommend over-the-counter or prescription treatments such as topical antibiotic creams to alleviate the symptoms. If folliculitis persists or worsens, contact your doctor for further guidance. The next less common side effect is numbness. Temporary numbness at the donor or the recipient site may occur due to disruption of nerves during the procedure. This usually lasts for several weeks before the sensation return. The treatment of numbness is to be patient, as numbness will typically resolve on its own. If numbness persists or worsens, contact your doctor for further evaluation. Another less common side effect is hiccups. Though uncommon, some patients experience hiccups after the hair transplant surgery. The exact cause is unknown, but it may be related to anesthesia, medicines, or stress. Hiccups usually resolve on their own within a few days. If hiccups are persistent or severe, your doctor may prescribe medications to help in managing the symptoms. You also can try and practice relaxation techniques such as deep breathing or meditation to alleviate stress-related hiccups. Now coming to the part 3 of this video, where we are going to discuss the rare side effects. Finally, let's discuss some rare side effects that can occur after hair transplant surgery. This includes scarring, shock loss, graft failure, and death. It is important to be aware of these potential risks even if they are rare. So coming to the first rare side effect, that is scarring. While some scarring is normal, excessive scarring can occur in rare cases, particularly in patients who are prone to keloids. Scarring results from body's overactive healing response or improper surgical technique. The treatment of scarring is to work with a skilled and experienced surgeon to minimize the risk of such scarring. In the event of excessive scarring, treatment options include corticosteroid local injections, silicone gel sheets, or laser therapy. Always consult your doctor before pursuing any such treatment. The next rare side effect is shock loss. Temporary hair loss around the transplant sites may occur as a response to the surgery. This phenomena, called shock loss, is due to trauma inflicted on the surrounding hair follicles during the procedure. Hair generally grow back within a few months. In such a condition, the treatment is to be patient, as they generally regrow naturally. You should maintain a healthy lifestyle and follow your doctor's recommendation for hair care to support hair growth. If hair loss persists, consult your doctor for further evaluation and potential treatment options. The other rare side effect is graft failure. In very rare cases, the transplanted hair follicles may not take root, leading to failed or poor growth. Graft failure can be caused by poor graft handling, infection, or inadequate blood supply to the graft. Sometimes there are rare skin disorders like alopecia areata, lichen planopilaris, and other scarring and non-scarring alopecias, which can also lead to poor growth. Treatment is to work with the experienced surgeon who knows how to minimize the risk of graft failure. If graft failure occurs, additional procedures may be required to diagnose the issue and to do another hair transplant to achieve the desired result. Consult with your doctor to determine the best course of action. Another rare side effect is scalp skin necrosis. This is possible in patients who are heavy smokers, have uncontrolled diabetes, heavy drinkers, or have some coagulation disorders or demand very high density. If you have any such medical problem, please share them beforehand with your doctor. Now coming to the last but most dreaded complication of hair transplant, that is death. Though extremely rare, there have been a few reported cases of death associated with hair transplant surgery. These are often due to complications like infection, anesthesia reactions, or other underlying health conditions. The prevention of this complication is to choose a reputable, experienced surgeon and discuss your medical history and potential risk in detail before undergoing the hair transplant procedure. Follow all pre-operative and post-operative care instructions to minimize the risk of complications. If you experience severe symptoms or have concerns about your recovery, you should always contact your doctor immediately. Now, in conclusion, we have seen that there are common, less common and rare side effects, and while hair transplant surgery has its risk, most side effects are mild and temporary. Being well informed and working with a skilled, experienced surgeon can help minimize these risks and ensure a successful outcome. Always discuss your concerns with your doctor before undergoing the procedure. If you find this video helpful, please give it a thumbs up and subscribe to our channel for more informative content on hair transplant.